Prof, thanks for your time. Why is it important that people do not default on their chronic medication?
I think it's very important that people understand that they are at risk of the severe consequences of coronavirus, particularly in the case of diabetics and hypertensives. And it's pretty obvious, your disease doesn't go away simply because we're in the midst of another pandemic. Diabetes and TB particularly were the two biggest killers in South Africa last year, and as I said, haven't gone away and are readily treatable. And if you interrupt your ARVs, your virus comes back and it starts hammering your immune system. People really need to get back onto their medication as quickly as possible.
Yeah, the people who've succumbed to this virus thus far, Prof, how many of them would you say, and I wonder if you have that kind of data with you, how many of them would you say had these underlying issues?
We've got some really excellent data coming from the Public Health Department in the Western Cape, based in Cape Town, and it's quite clear our epidemic's looking, in most ways, very similar to that what we're seeing in Europe and in North America, where most people who died were either elderly or had diabetes or hypertension. What was novel in that data is that also demonstrated a doubling in risk for people with HIV. Now, that wasn't as bad as with diabetes. What was also interesting is you had to have HIV and you needed to have something else like diabetes and hypertension. It's not good news, though, because our country has a diabetic epidemic on top of an HIV epidemic, on top of a hypertension epidemic. And now you have this new virus that comes along that selects those people out. So we really, as a country, need to be applying our brains to how do we protect those people? How do we make sure that they're the ones who are not exposed to the virus?
And how particularly vulnerable are those who have this virus? I think the country at the moment, if my math is correct, we have been told that it's just over 7 million people who are living with the HIV virus.
That's right. So HIV is possibly our commonest chronic illness, but diabetes is extracting a terrible toll in the background, as well as TB. As I said, TB and diabetes are top killers, actually. Were our top killers for the last few years since the ARV implementation meant that people weren't dying in these huge numbers of HIV anymore. What we're seeing in the country that's really alarming is a decrease in the number of people doing HIV tests, so who are monitoring the viral loads and all the rest. We're also seeing a decrease in our TB diagnostics, which means people aren't coming forward to get their TB picked up, which means over the next 6 months or a year, we're going to be picking up these pieces. People who delayed coming in for whatever reason. Many people have said that they're scared they're going to be arrested by the police, others are scared of the coronavirus. There are lots of reasons. But as I said, it's not like these diseases disappeared thanks to the coronavirus. They were there and they're going to come back with late diagnosis going forward.
Yeah, how receptive are hospitals, Prof, particularly at this time of the coronavirus? We've heard just how strict it is in hospitals for people to access. The people who are picking up this medication, whether it be TB or HIV, it's quite important for them to gain access to this medication. How easy or difficult is it? Are hospitals making it for these people to gain access to this?
So luckily, most of the medication is actually available in the primary care clinics, and most of the patients know where they can get it. And most of those clinics actually have done a fairly good job to start triaging, trying to move the patients with respiratory symptoms, which might be coronavirus, might be flu, into separate queues. So it is actually safe, so as safe as it can be. Also, what we've seen is that clinics are now able to dispense multiple months. So people can come in rather than having to come in every month or two. They can come in for a 3-month or sometimes even a 6-month prescription, so that they don't have to expose themselves at this stage. So, the health system has made some provision for this, but I think patients themselves are just terrified. The messaging, unfortunately, from the Department of Health has not been optimal.
Yeah. Final question to you, Prof. I mean, we're seeing right now the numbers peaking at an alarming level. Are we ready for the peak in the country? I think the Western Cape, it is estimated, or it has been said, that their peak might be next month, which is July. What's the situation looking like there? Are you comfortable? You are part of the Ministerial Advisory Council.
No, I think that's... I hope I'm wrong, obviously, and it's still very early days in our coronavirus epidemic, but things are not looking good. It looks like the wave of illness that we were expecting is coming. I think I'm often seeing in the media, like people, there's almost these two extreme camps, which is you overreacted with the lockdown, the other camp, which is the whole country is going to burn. I think that we are seeing a wave of coronavirus that's going to mean it's probably our worst infectious disease for the year, and a lot of people are going to get sick and are going to die. So we're wasting a lot of time in the courts, in the media, fighting amongst ourselves. It's almost as if the lockdown bought us time to simply tear each other apart internally, when what we should be talking about is how do we socially engineer those people I was talking about, how do we keep them safe? How do we make sure that public transport is safe, that the social protections are in place for what is probably going to be a pretty bad year?
Professor Francois Venter, thank you very much for your time. He's with the Wits Reproductive Health.